Hello. It is found that there are several deaths that are preventable due to poor accessibility of health services, especially in the sub-Saharan region, including Rwanda. Now, I have made my research to see the contribution of community health workers to the accessibility of basic healthcare services and awareness of under-5 children. In fact, I'm Mutajengo Vares, a student at Southern Hampshire University Full Care Practical Program. I hope you're going to enjoy this presentation. So in this presentation, you're gonna see motivation, problem statement, hypothesis, and the objectives, population sample size and sampling strategy, presentation of key findings, problem identified and practical solutions, contribution of the skills acquired to the research process, and research recommendation and research conclusion. So let's begin. It is found that this research is conducted to see the influence of community health workers to the awareness of end users, including parents, children under 5, and all people in general. So community health workers are health volunteers, to mean that they are not paid and they are nominated at the village level to provide those healthcare services I said earlier. Recently, there are around 58,000 of them in Rwanda, who increased from 12,000 since the introduction of 1959. So there are four community health workers at the village level. One payer of man and women in charge of providing basics of health services, another one in charge of caring prenatal, and another one in charge of social affairs. So, but generally, their all main law is to provide healthcare services to the people. So now let's see the problem statement. Under 5 mortality is a big problem to the world economy because considering Rwanda case, it is saying that it is to 5% of force reduction. So, as I said earlier, it is caused by poor access of healthcare services, lack of health literacy, poor healthcare systems, especially in sub-Saharan regions, including Rwanda in particular. So, according to 2013 research, around 5 children under 5 years died every single minute. This is huge loss to the world economy and the world health in general. Among them, it is seen that more than half of them are from sub-Saharan regions, including Rwanda, despite having 25% of total global births. So, moving forward, let's see the hypothesis and objectives of this research. So this research was conducted to evaluate if children who access community health workers services are healthier than those who don't access them. So the general objective was to evaluate the influence of community health worker services to the community, to the accessibility of basic healthcare services and the under-5 children's awareness. Specifically, to identify services that they can provide to the people, to access what people say about the services they get from them, and to see if there is some area of improvement in this campaign. So moving forward, the population is some side and the sampling strategy. Targeted population include the parents who have under-5 children, community health workers, and health providers authorities, including health centers and so on in the Malaba sector in particular. So target population is 500 people who are represented by 88 of them are some size. So the sampling technique used include simple random where everyone could participate randomly, and cluster sampling where they were in groups and discuss in the groups. So let me present now what I found from the research. So first of all, I was inclined to see if villagers know or have awareness of services that are provided those community health workers. First of all, I come to find that 7% of them know 1 to 2 services, 45% know 3 to 4, 35% something knows 5 to 6, and 11% know 6 and above services provided by those community health workers. But in the general, you can see that around 80% of those respondents or participants know around 80%. I mean, know between 3 to 6 services provided by those community health workers. So this is a huge trend to watch. Again, moving forward, so if they know their services, are they really willing to attend them? So 23% from the field, now 0 to 1 attended the services 0 to 1 in listed 3 months. So 20%, 30% of them attend the services 2 3 times in listed 3 months. 24% attend the services 4 to 5 times, and 12% attend them 6 and above. So you can say that people are willing to attend because in a 3 month time frame, people attend those services many times, as you can see by these percentages here. So now see if they attend the services. So do they find those community health workers there or present? So according to the data from the field, 7% of them, among the 3 recent times they visit them, they didn't see those workers around, but 12% saw them once, 28% something saw them twice in 3 times, and 51% something saw them all 3 times present. But generally, you can see around 80% saw or find community health workers present between 2 to 3 times among the 3 times they visit them. So moving forward, let's see if they have seen them present. So are they satisfied with the services they got from them? First of all, the first category of satisfaction was 15% something, where they say that they're very satisfied with the services they get from these workers. And the 55% something say that they are only satisfied, and 18% something they are not satisfied, and 10% of them they are not very satisfied. They mean they are very dissatisfied. But generally, you can see around 70 something, something appreciate services they get from community health workers. So, as I said earlier, there are 4 community health workers at the village level, and there are many ways to access healthcare services to the local villagers. And as achievement, they managed to reduce the under 5 mortality rates trend since the introduction in 1995. As you have seen that since there in 1995, the trend was world because around 238 deaths per 1,000 live deaths was huge number, but recently only 65 of deaths among 1,000 lives still needs to improve, but it is a good achievement. So they also managed to detect and treat some diseases, including malaria, especially because when it comes to the others, it is what they are able to treat completely. Again, they access other health services, including family planning methods, hygiene keeping, how to prepare a balanced diet, and other health education, also including mobilizing people to attend health insurance. So, problem identified and a practical solution. Most of the participants mentioned that financial barrier to the community health worker is still main drawback that make this campaign not effective. In fact, around 80% of them say that it's very bad to them because they need to struggle to find their living from outside. So that means they are not motivated, and they are not there always to provide their services motivated. So as the solution, our government and government bodies needed to collaborate to increase financial capability of these community health workers, and as well as increasing their competence towards many services they provide. That means in terms of quality and the quantity. So as we have seen that they are able to treat malaria when it comes to water, so they can also be treating influenza and so on. So increasing their financial ability and their competence in terms of quality and quantity of services they provide is a very good solution to this problem. So, moving forward, now let's see the contribution of skills acquired. So, in this research process, I'm going to give some example of skills, including problem-solving skills that helped me to identify the problem, data presentation, data analysis, data interpretation skills are very important to make these findings meaningful. Also, professionalism through interpersonal and intrapersonal management was good because I used to interact with participants and then use these skills to make this research more effective. So, as the conclusion and the recommendation, I do conclude that community health workers are very essential and crucial to the health of the community villagers because they have helped them to access basic health care services. So, and have seen that most end users, I mean consumers or end users in general, they are very satisfied. They appreciate these services, this campaign, and I do recommend the government and the government bodies to to improve the financial ability of these community health workers as well as contest towards quantity and the quality of services they provide to the people. So I do conclude by saying that thank you for your attention.